Welcome to People Profiles. Today, we're diving into the life of the father of medicine, Hippocrates. But before we begin, if you're new to the channel, take a moment to hit the subscribe button for more captivating stories and biographies featuring remarkable people from the past up to the present. The life of Hippocrates stands as a turning point in the history of medicine, marking the transition from mystical healing to rational, observation based practice. Widely regarded as the father of medicine, Hippocrates was born around 460 BCE on the island of Kos, a prominent center of culture and learning in ancient Greece. He belonged to a family traditionally associated with healing, believed to be descendants of Asclepius, the divine patron of medicine. Despite this lineage, Hippocrates would later challenge the very idea that disease was caused by supernatural forces. Hippocrates' early education was likely guided by his father, Heraclides, who was also a physician. Through this training, he gained foundational knowledge of traditional medical practices. However, Hippocrates' intellectual curiosity drove him beyond inherited teachings. He traveled extensively throughout the Greek world, including regions such as Thessaly and Thrace, where he encountered different cultures and medical traditions. These experiences broadened his understanding of health and disease, reinforcing his belief that illness had natural causes rather than divine origins. At the time, many people sought healing in temples dedicated to Asclepius, where rituals, prayers, and offerings were believed to cure ailments. Hippocrates challenged this tradition by proposing that diseases arise from environmental factors, diet, and lifestyle. He emphasized careful observation and logical reasoning, laying the foundation for clinical medicine. His approach encouraged physicians to study symptoms, monitor patients over time, and draw conclusions based on evidence rather than superstition. Hippocrates is traditionally credited with founding a medical school in Kos where he trained students in his methods. His teachings were preserved in a collection of writings known as the Hippocratic Corpus. Although it is uncertain which of these texts were written directly by Hippocrates, they collectively reflect his philosophy and influence. These works include detailed case histories, descriptions of diseases, and discussions of medical ethics and practice. They demonstrate a systematic approach to diagnosis and treatment that remains central to modern medicine. Among his most enduring contributions is the ethical code known as the Hippocratic Oath. This oath established principles for medical conduct, including respect for patients, confidentiality, and the commitment to do no harm. While modern versions have evolved, the core ideals continue to guide physicians around the world, highlighting Hippocrates' lasting impact on medical ethics. Hippocratic medicine was grounded in the theory of the four humors: blood, phlegm, yellow bile, and black bile, which were believed to govern the body's health. According to this theory, disease resulted from an imbalance among these humors. Treatment, therefore, focused on restoring balance through diet, exercise, and sometimes procedures such as bloodletting. Though this theory is no longer scientifically accepted, it represented an early attempt to explain human physiology in a structured and rational way. Hippocrates also made significant contributions to the understanding of environmental health. In his works, Airs, Waters, Places, he explored how climate, geography, and living conditions affect human health. This insight laid the groundwork for later developments in epidemiology and public health, emphasizing the importance of prevention alongside treatment. Throughout his life, Hippocrates earned a reputation as a skilled and compassionate physician. Ancient accounts portray him as dedicated to his patients and committed to advancing medical knowledge. He is believed to have lived a long life, dying around 370 BCE in Larissa. Over time, stories of his wisdom and achievements spread widely, and his name became synonymous with the practice of medicine itself. The legacy of Hippocrates endures more than 2,000 years after his death. His insistence on observation, logical reasoning, and ethical responsibility transformed medicine into a disciplined science. By rejecting superstition and emphasizing natural explanations, he paved the way for future generations of physicians and scientists. Today, Hippocrates is remembered not only for his contributions to medical knowledge, but also for the principles he established. His work continues to influence modern healthcare, from medical methods to professional ethics. In every careful diagnosis and every commitment to patient care, the spirit of Hippocrates lives on, a testament to his enduring role in shaping the art and science of medicine.